providing dental treatment and preventive dental care exclusively to children. That means we treat infants, we treat older children up to adolescents. I've been treating kids since about, say, 2011 when I joined my residency. I started my private practice in 2014 and continue to do so. We also treat a lot of children with special needs. And this disease, that is tooth decay or caries, like we say, is extremely prevalent today. We see it in very little babies, and we also see it in old children. In fact, it is research is saying that it is the most common chronic childhood disease, and that it is more common than even asthma. So, it's important that more and more parents and expecting mothers and young mothers, be aware of it. And I think the awareness about oral care and oral health of little children is still less in our country. And that's why we're here. So I would like to share my experience and, how you can deal with this right from the beginning and make sure that it's completely prevented in your child. Right? So let's start. So, this is the first thing I want to address. Like, even when I discuss this with some of my friends or even mothers, like patients, when they come to us, they're just surprised. They're like, tooth decay, really? Can this be tooth decay? My child is a little baby. I've never heard of this before. Or is that even possible? So that's the first thing we need to know. Yes, it is possible. And I want to show you some images as to how it looks. We'll see a few pictures from, say, a slightly older child in decreasing order of age. So that's what tooth decay looks like. This is a child who is 2 years old. Now that is a cavity, or like we all know cavity. That's what decay looks like in a back tooth, in a molar. That's a milk tooth. And this baby is just 20 months old. There again, you can say decay, and you can see one tooth is almost broken off due to decay. This baby is just 19 months old. There you go. You see so much of decay in this little baby who's just 18 months old. You can tell that the child is so young because you can see some of the teeth are still erupting. They're still coming out. And already there's so much of decay visible. Again, this is another child. Only 8 teeth have come into the mouth, out of which 4 of them are already decayed. This is a baby who is 16 months old. Now you see this child, believe it or not, this child is just 9 months old. Aap socho, itna chota bacha, the baby is so little, just 9 months old, and already you can see early signs of decay in those teeth if you look very carefully. So let's look at what causes it. Like, ये क्यों होता है, क्यों decay आता है? Like, mostly parents ask me, like, हमने तो कभी नहीं देखा, हमारे दांत तो कभी इस age में सड़े नहीं थे. Why is this happening? So let's look at that, right? So the first thing is bacteria, right? Without bacteria, you can't have this disease. But where does this bacteria come from? ये कैसे आ जाता है into the child's mouth? It is typically from us, the caregivers, the mother or the father, the grandmother, because we all as adults, हमारे mouth में तो ये bacteria होते हैं, right? Plus, if I have cavities, or if the mother has cavities that are not treated, that means there's a lot of decay, there's a lot of bacteria in my mouth. And when I share an instrument, share a spoon, or if I blow into the child's food and kiss the child's hand or the mouth, of course, the bacteria is going to get transferred into the baby's mouth. So there, the bacteria is transferred. What do you need else? Lack of brushing. So a lot of parents say that नहीं हमने तो start नहीं किया, अभी just 8 दांत आ गए तब हमने start किया, पहले हम नहीं करते थे, अब start किया. So brushing is usually introduced very late in the baby's life, after a few teeth have already come in, and more so sometimes the baby will not allow it, the baby will cry, so the parent will just give up and they'll say it's okay, it just goes into the back burner. Brushing doesn't become very important. So if there is lack of brushing, that's the other reason. And plus the introduction of sugar very, very early. This is basically artificial sugar that we are talking about. And sometimes even inappropriate feeding, which we will address in some time. We will discuss this, what happens. So basically, if there is sugar in the diet, brushing ठीक से हो नहीं रहा है, and bacteria तो mouth में पहुंच गया already, this will result in cavities or tooth decay. So now I want to know मैं चाहती हूँ कि आप जानो ये कैविटी कैसे दिखता है, इन द सेंस कि अब हो गया तो मुझे कैसे पता लगेगा कि इट्स ऑलरेडी स्टार्टिंग. वी डोंट वांट यू टू वेट टिल इट्स बिकम रियली बैड. हाउ डू आई कैच इट अर्ली? वी लुक एट दैट and then I will talk to you about how we can prevent it. Right? So caries is what tooth decay is called. So we look at this child, the 9-month-old baby. If you look very carefully, आपको दिखेगा इन दांतों पे white color का एक patchy appearance दिख रहा है इन 3 दांतों पे, और एक दांत पे आपको छोटे से खड्डे दिखेंगे, which is your so-called cavity, right? So this white patch indicates that decay has already begun. That means the bacteria is attacking those surfaces. अब तक cavity नहीं हुआ है, but already वो disease start हो चुका है. And in that one tooth, you see a small cavitation. So this is how it looks first. And if we don't do anything about this, if you do not visit a dentist, don't get any care, and if things don't fall into place, the same baby, when the child was 22 months old, for some reason they were not able to, they were shifting countries, etc. Look what has happened. The teeth are completely destroyed. वो जो ऊपर का enamel का layer होता है, वो तो completely जा चुका है. This baby is not even 2, and you can see what has happened. So this is another picture where you see what the decay looks like. आपको दिख रहा होगा कि कोई जगहों पे वो whitish patchy दिखता है, and कुछ areas में आपको cavitation दिखता है. So sometimes we get a call from parents saying, there's something on my baby's teeth, it's like yellowish brown, लगता है खाना अटक गया है, and I keep brushing it but it doesn't come off. So the parents don't even many times know that this is actually decay. So once you see this, now you know what you're dealing with, and that you may need to take your child to a dentist. So it is very heartbreaking to see these very little babies, 16 months old, 14 months old, already dealing with this problem. I know it's sad that this even happens. However, it is completely preventable. So that's the good news, and that's what I'm here to tell you about and talk to you about. So we look at, say, about 10 pointers that you can do, and so that you can keep this disease completely at bay. So what's point number 1? So पहली चीज जो मैंने आपको बताया कि आपके माउथ से ही वो बैक्टीरिया आपके बच्चे को जाता है. So the first thing is that you yourself brush your teeth really well. You use a fluoridated toothpaste, and start this very early. Like as soon as you're pregnant or you're planning, you ensure that if you have untreated cavities in your own mouth, which have not been treated as infection, that a lot of cavities, get them treated. They are better for your pregnancy as well, because you don't want toothache and those things happening during your pregnancy. And plus, it brings down the bacterial count in your mouth so that it doesn't easily get transferred to your baby. So that's the first thing that you want to do. Secondly, now the pregnancy part is over, the baby is here. The first thing you want to do is cleaning the baby's mouth. So even if there are no teeth in your baby's mouth, and the baby is only being exclusively breastfed, it's a very, very good habit to start using a soft cloth, which you can just wind around your finger, dip it in water, and just run that, your finger in your baby's mouth, say twice a day. What this does is actually it desensitizes the child's mouth. बच्चे को पहले दिन से आदत हो जाती है कि अच्छा माउथ भी क्लीन होता है, बिकॉज बात जैसे हम नहलाते हैं बच्चे को पहले दिन से, सो द बेबी गेट्स यूज्ड टू इट, दे अंडरस्टैंड कि ये रूटीन है. और ब्रशिंग एंड माउथ क्लीनिंग हमेशा हम बहुत डिले कर लेते हैं. तब तक द चाइल्ड हैज लर्नड हाउ टू से नो. द चाइल्ड विल से नहीं, मुझे नहीं करना, एंड देन इट बिकम्स डिफिकल्ट एंड द पेरेंट गिव्स अप. Whereas when the baby is very young, if you start this habit, जब आप ब्रशिंग स्टार्ट करोगे बच्चा ज्यादा रेजिस्ट नहीं करेगा. So this is a good thing to start very early. Now, once the tooth has come in, pehla daant, when the first tooth comes into your baby's mouth, you have to start brushing. That's again a method to get the baby used to brushing, by the time more and more teeth come into the mouth. So let's talk about how am I going to brush my little baby's teeth. The first thing being the positioning. So this is how we examine little babies in the clinic, but this is exactly how you should also brush your baby's teeth. So if there can be two caregivers, mother and father, mother and grandmother, nanny, anybody, we call it a knee-to-knee position. So both of you sit in front of each other, join your knees, and the baby is just sleeping on your lap, like you can see. And the person sitting in the front, say the father will just take care of the baby's body, the baby's hands are held on, and the baby is looking at this person. So this person can keep talking, the father can keep talking, interacting, singing to the baby, and all the mother needs to do is basically just, focus on the brushing. Just a second. I think there's just a second. Sorry about that. I think there was some glitch. So yeah, we were talking about the knee to knee position, right? So that's how you sit. And then if I am the brusher, the father's holding the child. If I am the brusher, I'm going to use my left hand and I'm just going to sort of stabilize my baby's head. I'm going to open the mouth like you can see in this picture. And with my right or my dominant hand, I'm just going to brush the teeth really well. We say usually just circles banao teeth pe, circles, हर एक दांत पे circles बनाओ, front, back, सारे surfaces पे. So this is a great way to brush so that your child is held really well. अच्छे से बच्चा securely रिस्ट्रेन किया गया है, अच्छे से पकड़ा गया है, तो बच्चा ज्यादा मूव नहीं करेगा, तो आपको ये डर नहीं होगा कि उसे कहीं लग जाएगा, ब्रश स्लिप हो जाएगा, और आपको अच्छे से दिखेगा, so you're able to do a good job. Now, sometimes it's possible that two people are not there. It's just one person, right? You may be alone. So in that case, this is the way you want to brush your baby's teeth. अब इस picture में ये Google image है. It's not very you can say you can do still a better job जहाँ पर बच्चे का जो दोनों हाथ है वो भी आपके पैर के बीच में, you can restrain the hands and आपके पैर जो हैं आपके बच्चे के पैर के ऊपर आप क्रॉस कीजिए ऐसे. So अब बच्चे का पूरा body basically hands and legs stabilized है और फिर आप हेड को एक हाथ से स्टेबलाइज करके ब्रश कर सकते हैं. सो आप अकेले हैं तो you can use this position. And a great way to get your child to enjoy brushing is वो पहले दिन से जब एक या दो दांत आ जाते हैं आप एक ब्रश खरीदिए अलग से, which is the child's brush, और उनको इस चीज को एक्सप्लोर करने दीजिए. Just put the brush in the mouth and just feel it, how does it feel, and the child finds it fun, like a toy. They might keep chewing on it, chomping on it. और आप रहिए, सुपरवाइज कीजिए. डोंट लीव द चाइल्ड कि वो ब्रश लेके इधर उधर भाग रहे हैं, फिर इंजरी हो सकता है. बट दिस इज अ गुड वे टू introduce brushing very early and the child will accept it well. Or even if बच्चा बहुत रोता है, give up नहीं कीजिए. That's the important thing. Hang in there. Let him cry today, he'll cry tomorrow, he'll cry for a week, maybe he'll cry for a month. But after some time, he will get used to it and then he will not resist. So the idea is to just hang in there. So we say that you have to assist brushing till your child is 8 years old. So एक बार आपका बच्चा थोड़ा बड़ा हो जाता है, say 3 years old, 4 years old, फिर आप ये positioning नहीं कर सकते. So in that case, you can just be behind your child और आपका child एक raised stool पे खड़े हो सकता है या एक raised chair पे बैठ सकता है और आप उनके पीछे खड़े हो जाइए. Just tilt the head backwards and then you can brush all the teeth. Like I said, you can make circles on the child's teeth. Now, let's come to point number 4, that is using a fluoridated toothpaste. It's important that जो toothpaste आप use करेंगे उसमें fluoride हो. So if the baby is very young, up to the age of 3 years, you have to use a very small amount of toothpaste, which is like एक चावल का दाना जितना. Once the child is above 3 years, then you use a little bit more, like about a green pea sized amount. So that's the quantity of toothpaste you have to use. Number 5 is to clean your baby's mouth after eating anything or after snacking something. इसमें क्या होता है कि immediately after the baby eats, again, like I told you, the cloth, just wipe the mouth and the baby becomes used to this. And a very important thing is that children are very good imitators. They may not listen to you. So when the baby sees that my brother or my sister is brushing, my parents are brushing, grandmother is brushing, they will automatically take up to it more easily. Now the most important point is this. जब तक आपका बच्चा 2 साल का नहीं हो जाता, कोई भी artificial sugar please introduce नहीं कीजिए. This is the one thing that you can do which will completely, almost prevent any tooth decay. So when I say artificial sugar, I mean all of this. जैसे कि biscuits हो गए. It's not just chocolates and candy. Biscuits हो गया. Good से भी decay होता है. Jaggery से decay होता है. Honey से होता है. Packed juices, cornflakes, tomato sauce, chips, all these things will have some amount of sugar in them. So we want to keep all these things away till your child is 2 years old. And instead choose healthy options. आप सारे milk products use कर सकते हैं, natural sugar दे सकते हैं जो fruits में है, of course vegetables, oatmeal, घर पे बना हुआ कोई भी snack आप दे सकते हैं, but don't introduce any source of artificial sugar because that is the main reason ये bacteria cavities produce करता है. Now, coming to the feeding bit. Now, breastfeeding. When we talk about breastfeeding, it's the mother's decision. वो कब तक breastfeed करना चाहती है. You can breastfeed your baby till he's 2, till he's 3, no problem. लेकिन एक बार बच्चे के माउथ में दांत आ जाते हैं, फिर वो breastfeeding में थोड़ा discipline लाना जरूरी है. What is that discipline? It is basically at night, the baby should not be feeding again and again and again. So basically, the baby has to eat a good dinner. the stomach should be full, after which you will give a nice round of brushing. तो जो भी खाया हुआ है वो सब clean हो गया है. उसके बाद you can give one last feed, followed by simply just cleaning like that or giving some sips of water. Now the baby should not feed again and again. Breastfeeding या breast milk से cavities नहीं होता, लेकिन usually दांत आने के बाद तब तक already complementary feed add हो जाता है, बच्चा बाकी सब खाने लगता है. So that food basically that the baby eats may be stuck on the teeth, maybe the brushing was not adequate, you did not do good brushing, there is some plaque on the teeth, and now the baby feeds at night, feeds again and again. तो वो जो breast milk है and जो food जो mouth में चिपक के रहता है, it forms a layer on the teeth all night. That is what actually leads to decay. So you can still feed, but the baby should not associate feeding and sleeping. So even in the mornings or in the afternoons when the baby feeds, let the baby nurse and then play for some time. Similarly, at night, after the last feed, the baby should not wake up again and again. So the baby is usually not hungry at that point. It is more like comfort feeding. So you want to not feed the baby again and again in the night after teeth have come in. And then the most important thing, which is respect to bottle feeding. We usually say by age 1, the bottle should be just stopped. Maximum by 18 months, bottle feeding should be just completely stopped. The baby should be weaned off the bottle. And by age 1, the baby should learn to start drinking from a cup. And again, the same thing with bottle feeding, even at younger age when the baby is being, say it is pumped milk or it's formula or anything, the baby should not associate with feeding and sleeping. That means the bottle is just given to the child for an hour or so, the baby is feeding, and then going off to sleep. Again, the same thing will happen. The milk will just pool in the mouth and it can lead to decay. Secondly, us doodh mein bhi sugar nahi add kijiye. And, even in the juice, don't give any juice or sugary liquid in it, preferably water. So that's the other pointer. And coming to one last thing, that is pouching. You don't want to introduce screen time. WHO says that there should be no screens given to children before 18 months of age, because this is what leads to them eating very slowly. They'll keep looking at the screen, keep the food in the mouth. That's the other thing that leads to decay. And the last most important thing that I want to tell you, that most parents are not aware of, that the first dental visit of your child, preferably to a pediatric dentist or to any dentist who regularly treats children, should happen when the child gets the first tooth. Usually that's around the first birthday. So we say if you make one visit, the first visit when one tooth comes in, you can almost always avoid decay or prevent cavities altogether. Thank you so much for listening to me. This is my contact details. If you have to say write to me or call us or contact us in any way for any queries, we'll be available. Thank you for your patient listening. So we'll take any questions if you guys have. I think I'll be getting them on this section on this side. So regarding any of these points or anything related to this, if y'all have any questions, please shoot. So we have a question from Lakshmi Mishra, who says, does ice creams also cause tooth decay? Yes, absolutely. Anything with sugar. So even if it's your milk at home and you're going to add Bonvita to it or sugar to it, anything. So ice cream has also got sugar. If you make a healthy paratha and you put sugar or jaggery in it, it makes that also the entire meal sugary. So of course, if you think about what is more harmful, if the child eats a biscuit or chews on something that is sweet, that is sticky, and it's going to stick on the teeth, that's more harmful than a liquid. So ice cream you can consider liquidy hai, so it's less harmful, but yes, it can still cause decay. However, it's more easy to clear it from the mouth. आप आराम से मतलब उसके बाद पानी देंगे, अगर बच्चा कुल्ला कर सकता है या पानी पी सकता है, it can be cleared from the mouth more easily. But I would say till the child is about 2 or 3 years, जब वो completely आपके control में है, अगर आप sugar avoid कर सकते हैं, that will be better. Yes, there's somebody who says what precautions one must take to avoid tooth decay. Yeah, that's all these pointers that I've told you. Everything from, visiting a dentist to make a preventive visit right in the beginning. So hum और ये सब whatever I'm explaining to you, we can explain it to you in more depth when you visit us. And taking care of the sugar intake, the breastfeeding tips that I gave you, oral hygiene, all these techniques. Um, Yes, so Rachna is asking, how do you fix baby bottle tooth decay? So yeah, so this is a very extensive topic in itself. However, if you catch it early, जो मैंने आपको pictures दिखाया जहाँ पे you can see those white patches or it's very early, we have simple gels or creams that can be applied on the teeth and you can actually stop the decay from getting worse. एक बार decay हो गया दांत पर वो reverse नहीं होता. मतलब typically fillings होता है, उसको clean करके हम fillings करते हैं, which is very difficult in a very young baby. But there are some very easy techniques today in dentistry that can be, उसमें all you have to do is apply it on the teeth and decay completely stop हो जाता है. So that is one way to treat it. Yes, so Preeti saying, is it reversible? That's what I'm saying. It is not reversible. You cannot grow back the enamel or grow back the tissue once it is lost. So what you can do is you can prevent it from getting worse. और अगर बच्चा थोड़ा older है, like 3 years है, comfortable है, and a lot of children do well, then we are able to, I mean, they're comfortable at a dental clinic. If you saw the last slide that I showed you, those were all little babies who had visited us. We can do fillings or so to cover it up and make it look aesthetic again. Can decayed baby teeth affect permanent teeth? Yes, they can. So what happens is, kabhi-kabhi wo decay unchecked reh jata hai. The decay is there and the parents for some reason don't visit, or somebody tells them it's okay, they're just milk teeth, don't treat them. And it continues and continues and finally it lands up in pain and swelling. Wahan par pus jam jata hai and then it's a problem because there is, a permanent tooth which is developing inside your baby's jaw. So if the baby's milk tooth is going to get infected, and that there is going to be pus formation, but obviously it's going to affect the permanent tooth that is developing inside. Not only that, when the child is a little older and permanent teeth come into the mouth, अगर बगल में सड़े हुए दांत है और यहाँ पर नया अच्छा दांत आ रहा है, but obvious है कि ये बैक्टीरिया यहाँ से यहाँ जाकर इस टूथ को भी harm कर सकता है. So yes, it can affect the permanent teeth. How often should I brush my child's teeth? Asks Saili. Well, it is a must that you brush at least 2 times. That's once in the morning and once in the night, compulsory. If you can run a brush otherwise without toothpaste, say he chomps on a biscuit or something, or agar aap quickly brush घुमा सकते, even the third time, nothing like it. Akanksha says, which toothpaste should I use for my 24 months old? So international world over guidelines say that even a little baby needs to have fluoridated toothpaste because fluoride decay prevent karta hai. And in our Indian market, the only toothpaste that provide adequate amount of fluoride are the adult pastes. So you have to buy your regular adult pastes and then give the amount of quantity that I showed you. So if your baby is under 3, that's 24 months, up ek chawal ke dana, 1 rice grain, that's how much of toothpaste you will be putting on the brush of an adult paste. And once your baby is above 3, you can use a green pea sized amount of fluoridated toothpaste. My child drinks bottled milk at night, which would affect my child's teeth. Yes, absolutely. Your baby should not associate with bottle feeding and sleeping. The baby should be given the bottle, stay around, he finishes having it, say at meal time or as a snack. Like establish a routine when the baby will feed. And then say in 15 minutes, the feed is done, you take the bottle out, the baby cleans the mouth. I mean, you give water or something and that's it. But if the baby is going to sleep and the bottle is in the mouth and the milk is just pooling, yes, it will cause cavities. What should I do for my tooth decay for my 3-year-old? I don't know how much it is, how badly affected it is. So the treatment depends on how severe it is. So I would recommend that you find out a pediatric dentist in your locality, in your area, and visit them at the earliest, agar aapko dikh raha hai ki decay start hua hai. Palak says, my daughter doesn't allow me to brush. What should I do? She's 2 years old now. Yeah, so now your child is a little older. You have to make this fun for them. So one way is to reward them. So what you do is you take your brush, give your baby her brush, make it an activity, sing a song and say, if you're going to brush well and if you're going to allow mama to brush your teeth, then we have something for you. So when the baby brushes well, stickers kharidiye, simple rewards, put a star on her hand or so, and make it sort of like a fun activity. In the beginning of the baby is not allowing, ro rahi hai, aisa kariye, you will have to unfortunately restrain her. Aap do jan ko milke, maybe you and your husband or somebody, like I showed you, you'll have to hold the baby and then brush and not give up. वो रोएगी, चिल्लाएगी, it will happen for a week, it will happen for 2 weeks, but after that उसको समझ में आ जाएगा कि मैं कुछ भी करूं, ये brushing तो करना ही पड़ता है. Mama is not going to let me escape, so she will adapt. So that's what you can do. Rebecca says, there is a white layer on my son's teeth. What must be the reason for it? I brush his teeth twice a day. So like I said, most of the times the white patch indicates the beginning of decay. Now there are some other reasons too. Sometimes it's a defect, like that aate hi you might have seen the white patch. So we don't know if it was that or whether it developed later. Most likely it's the beginning of decay. It's nothing to worry. As long as there's no hole there, it's still very early. So if you keep brushing well, you use the right toothpaste and the sugar is completely under control, it should be under check. However, no harm in just visiting a pediatric dentist so that you can, be sure about how to go about it, or rather how severe it is. Madhu says, my daughter is 1 year old. Is the dental checkup necessary? Yes, Madhu. See, there's no harm. See, it's like saying we go to the pediatrician regularly, right? For vaccinations, your baby will cry, but we still make that visit. So this is also just one little visit like that, just to get the teeth checked. Also, if you regularly visit, say you went at age 1, then you went after 6 months, the baby becomes used to visiting this particular clinic and that particular doctor. It becomes like fun, and usually a lot of pediatric clinics, dental clinics are very child friendly. Wahan pe toys hote hain. It is a very child friendly environment. So tomorrow, God forbid, but if your child develops any dental problem, the baby becomes used to visiting this clinic and it doesn't become a threatening environment for the child. So yes, do it. And abroad, in a lot of places, it's part of the baby's routine. Like as you regularly visit for vaccinations, they also visit preventively for their dental concerns. So I think you should. And Anvita says, which kind of brush should I use for my 1.3-year-old? Yes, so there are lots of them. So there are a lot of brands which will clearly mention on it, baby toothbrush 0 to 2. If I should take some brands, it could be Colgate, it could be Mimi, it could be Mama Earth, Oral-B. They all have them. And you must look. They'll all have these super soft bristles, and usually it will be written 0 to 2. So I think you should buy that toothbrush. To begin with brushing, yeah, some mothers will say they want to start with the finger brush. Yes, when there are only 1 or 2 teeth, you can even start with the finger brush. Once you have more teeth in, you can switch over to a regular brush. Naina says, my son is 3 years old. He brushes his teeth regularly, but he still has a white layer on his teeth. What should I do if he brushes twice a day? Naina, you can just keep an eye on it. If all there is the white layer, you keep brushing. You ensure that biscuits and sugary stuff is not frequent, probably once in 2 weeks as a treat. All these things, like I showed you in that picture, tomato sauce khana, etc., it should be a treat. And jo cheezein aapke bacche ne dekha nahi hai, like if he doesn't know sauce exists, or he doesn't know cake exists, or chocos exist, then don't even show it to them, and what he likes. For example, biscuit acha lagta hai, make it a treat, a special fun food that is eaten, say, once in 2 weeks or so, or an occasion maybe. So us din pe he can have a couple of biscuits, and then don't stock it in your house jahan bacche ko dikh jata hai. The moment the baby is hungry, then he's going to throw a tantrum, and then you'll end up giving. So what you can do is just watch on the white patch. If you see the white patch is looking worse, bada ho raha hai, cavity dikh raha hai, then you don't wait, then you must seek care. I would say, agar aap abhi tak aapke bacche ko dentist ke paas nahi le gaye ho, then making one visit will only be good for him. Yeah, I think we attended to most of the questions, right? So yeah, that is it. So this disease is preventable. Nobody can be ideal. Everything cannot be perfectly in place, but you can try your best. So the brushing twice, keeping the bottle. Your baby should not be addicted to the bottle. After teeth are in, establish a good routine of breastfeeding. Cleaning the mouth regularly, and sugar. That's the most important thing. Don't introduce artificial sugar. जितने भी एज तक आप इसको डिले कर सकते हैं, that would be the best thing for your child, because it automatically makes your child like other things. मतलब एक बार वो sweet taste लग जाता है, then they expect कि सारी चीज मीठा हो. फिर आप वो एक vicious cycle हो जाता है कि अच्छा नहीं खा रहा है, जैगरी डालो, नहीं अच्छा लग रहा है, बिस्किट दे दो. But whereas अगर उसने टेस्ट ही नहीं किया इस चीज को, when he is very young, the baby doesn't know sugar exists, right? Then he'll probably not ask for it. He'll take up to vegetables, he'll take up to more fruits and other things. So keep it away till the baby, say about 2 or even 3 for that matter, and then slowly you can introduce it like a treat. So that brings an end to this. So my name is Dr. Pooja Rajagopal, and I did share my Instagram and my Facebook handles, and even my telephone number. You can contact us on. We are called Smile Stories _Junior on Instagram, and we are called Smile Stories Junior on Facebook. I practice in Pune, and you can look me up on Google. And if you think you have any queries, or anything that you may want to write to me about or call us about, please feel free to do so. And yeah, happy brushing your own teeth and your babies.